Hello, everyone, and welcome. I am Gabby Panetta with the All About Wellness podcast, and today I have the pleasure of interviewing Vickie Shi, who is a registered nurse and focuses on foot care. Welcome, Vickie.
Thank you for having me.
Oh my goodness. Now, correct me if I'm wrong. Your business or your clinic is called Step Forward Kingston.
Yes.
Okay, so you're located in Kingston, Ontario, and you are also going to be part of the All About Wellness Expo, which is happening May 30th to June 1st this year at Portsmouth Olympic Harbor. So, welcome to the roster of exhibitors. But first and foremost, I guess, Vickie, tell me, how did you end up becoming a foot nurse?
So like I used to work in the long-term care facilities in Newmarket. So during my work in the facilities, so I noticed a lot of the seniors they require like a foot care, especially in the diabetic populations. But as a floor nurse, we're not able to perform anything for them because we're not specifically training for the foot care, and we don't have correct tools. So we see a lot of people are struggling, and their family have to find um, like like the specific the foot care nurse from outside the building. So that's why I wanted to do something like a more specific. In the same time, like my parents, they all like having diabetic. So like I think that is more like helpful in the future. And I
Yeah.
like to spend more time with my clients, like to talk to them, to know them, and yeah, that is more fun to do like that than working in a facility, I think.
Right, absolutely. So, walk me through, okay, what types of diseases or conditions do you actually see in nails? Because one thing that I have a healthcare background as well, and one thing that I've noticed is that people do not take their nails seriously. They
Yeah,
just assume that nails are to be painted and that's it.
well, yeah, like we're different than pedicure. So we can call ourselves like a foot care, but like sometimes there's a foot care nurse that also call themselves a medical pedicure. So it's like we don't use polish to cover your issues. So we address your issue and fix them. So
Right.
most of the people we see them is like either they have like an ingrown toenails, which is very painful. Like the pedicure, we're not able to help them with that,
Right.
and also like a fungus.
Right.
So that's the two main issues in our clinic. So we're helping them for that, and now we're introduced another new technologies for words to training words. Yeah, so like it's not painful. It's very easy. So in the expo, I will have more information. So I will
Right.
do a yeah. I will have
Okay.
some printout for people to get more information on that.
Okay. So why does it take so long for foot fungus to clear? Because I've met many people who have had it. And when I ask them, so how long have you had it? They're like, oh, 2 years. And I'm thinking, whoa, what the heck? 2 years?
2 years is not long. I have a client that they have like 20 years, 15 years,
Oh,
thing like that. Yeah.
wow.
So
Yeah.
like because fungus is basically is like existing in our environment. So if you have fungus in your on your nails and you put it in the same foot into the socks, so even you get treated from the normally it's like a Jublia is a doctor's prescription for treating
Right.
fungus. But
Yeah.
like if your feet just go back to the same socks, same shoes, same environment, so it will get back. So we
They're
basically we're not
reinfecting.
only training like the treating nails and on your foot, it's also like an environment as well.
Right.
And with
Okay.
yeah, with like if you go to your family doctor, get a prescription, and you just like brush it onto your nails, it not gonna work. So a lot of people were saying, yeah, that doesn't work. But it's not because it doesn't work, because your nail need to be filed down in order for the medication to work. Because with the very thick nails, so like, for example, if you have them for a couple years, so your nails already disformed.
Yeah.
So it is not like a regular shape or like the structure. So the medication were not able to reach the place they're supposed to go. So that's why
Interesting.
it doesn't work. Yeah. So that's why we suggest people like they can come to us every 6 weeks with 5 nails thinner. So for the medication we're in order to work. So we also
Okay,
have a different
interesting.
way to treat the fingernails. Like in the expo, I'll have the information as well. Yeah.
Okay. Okay, so what you're saying, and correct me if I'm wrong, is that the nail surface needs to be filed down to make it more porous so that the medication can penetrate.
Exactly. Yeah.
Okay, okay. And let's talk about diabetes and the importance of foot care for diabetics, because again, another disease that people take for granted and they're, oh, it's no big deal. And I have met people who have lost their if not toes, their feet and
Mhm.
legs because of diabetes. So I'm big on promoting the fact that you should never take diabetes mildly. It is a very serious condition, and anything as simple as a blister on your foot can cause gangrene if not taken care of properly.
Yes.
So,
So
how do
with the
you?
diabetic population, because with if they have a diabetic for like a long time, so they reduce the sensation on their lower end. So that will be that will call the neuropathy. So
Yes,
like you don't feel much. So if you have, for example, like a cut, and you won't know until something serious happens. And because you're diabetic, your circulation is kind of slow. If you have a wound and down there, then you don't know, and it take a longer time to heal. So that's why we suggest diabetic population to come to see foot care nurse. One is like to assess your foot, and also like the way we're cutting your nails is a proper way to cut your nails. Because so you don't developing, for example, like ingrown toenails
right.
to poke into your skin causing problem, or like we don't nip your skin. And some people like, because they're seniors, like it's far to see your feet, or like you don't have no strength in your hand to cut properly, so they will cause you more problem.
Right. Okay. And what about overall skin care on the foot as well?
Skincare is like most of people will have like a callus or corn. So with the
Hmm.
diabetic, they don't feel the corn like a painful. Like they don't feel it. That's why we suggest like a diabetic population they wear diabetic socks in white color. So if there's any cuts, you can see. When you change your socks, you can see there's something happened. So if it's in the dark color,
Interesting.
you won't see it. So you
Right.
will find the problem earlier before it's getting too deep. Yeah, we have been
Okay.
seeing people having actually ulcer because
Yeah.
the the corn, but they don't know. So when they
Right.
develop into like they see it on the floor, say, "Oh, what happened? There's blood." So yeah, that's too late. So that's the chance you will causing your a toe or leg or feet.
Okay. And how often should a diabetic get their feet checked to ensure
It's
that these types of complications don't happen?
So normally we suggest 4 to 8 weeks. Depends like what is your condition is. Most of people do 6 weeks, but
Okay.
like with the diabetic in the community, we suggest for 4 weeks. If you're already like for example, having neuropathy. Yeah.
Okay. Interesting. And what tips can you give people
You can see from, for example, your nails, like if your nails is like easy to crack or easy to like split, it means
yeah,
there's something happens in your body. Either you're taking a lot of medication, could be a side effect of medication, or you lack or some mineral, yeah, thing like
right,
that. And
right.
also like a lot of people have like a dry skin or like a cracked heels.
Yeah,
Yeah, we have a lot
yeah.
of runners. Yeah, they have like, for example, they all,
Don't runners lose their nails because they're constantly doing trauma to the nail?
yes, they do.
Okay.
Yeah, and
Yeah.
Palace corn is another thing. A
Okay.
bunions.
Bunions. Oh, yes, because their shoes are too
The
tight at the
shoes is
front and
tight.
it'll
Yeah.
compress the joints like so.
Yes. Like another thing I wanted to say is like for our service, not only for diabetic or seniors, we actually have a lot of teenager.
Yes.
Yeah, because they play sports and the
Hmm.
ingrown now is one of the thing. And because the teenager they're still growing, their feet is growing fast, and
Yes.
probably their shoes is getting smaller very soon before the parents even notice it.
Right.
Yeah,
And so their feet are always getting squished.
always squeezed, and they don't really say anything. I think they can take a lot of pain.
Yeah, yeah.
Yeah,
Um,
so mhm.
so hockey players, dancers, anybody that plays sports, basically, you would be the person to see to prevent the injury from getting worse or prevent injury in general. Because, I mean, I guess the recommendation would be to get wider sports shoes.
Wider sports shoes, and because we have a lot of like a soccer player, so they have to wear the pointing shoes.
Okay,
But
yeah,
yeah, but that's why we have like the way to treat the ingrown nails. So it's
yeah,
before they getting in the worst condition. Yeah,
right. Yeah, baseball players have that issue as well.
yeah.
Um, okay, so what tips can you give to the general public for foot care before they and have to see someone like you?
Well, they I think that the most important is like you're gonna have to assess your feet. Like you make sure you have a moisturizer, especially when summer comes. Like everybody's to start wearing sandals. So like your feet is getting dry, the heel is getting dry. So like I'm not saying like everybody have to file their heels, but like
Right.
yeah, but once like after your shower, you have to make sure you're dry in between toes, so you don't have like a moist in there, so you don't trap any bacteria to have a skin breakdown, and then make sure you have lotion or moisturizer.
Right. So you mentioned the moisture in the feet, which is why it's important to dry them thoroughly after a shower. Athlete's foot. Is
Yes.
it just something that athletes get, or is it like almost
Athlete's foot
anybody?
is basically it's like a fungus infection on your
Right.
skin. Yeah. So it's
And
not
tell me,
necessarily have to be like an athlete to get it. Like everybody
right,
can get it because it didn't dry properly. A lot of people like they have sweaty feet.
right,
So yeah, so you're gonna have to change your socks more often, for example. Make sure your shoes are dry. Yeah.
okay.
And
Um,
I'm not sharing towels between family members because that transfer to other people as well. Yeah.
Exactly. Yes, this is where hygiene people and prevention infection control comes in. There's a reason for it. Okay, so we've got athlete's foot is a fungus on the skin, and then the skin fungus, sorry, the nail fungus is different from the athlete's foot fungus, correct?
Well, they're basically a lot of people they have acid foot first because they're
Okay.
itching. They use their nails scratching the skin or stuff, and then you transfer onto your nails. Or the other ways, like you get your nail fungus first, and
Right.
you're touching and all stuff. Like you go transfer onto the skin. So basically, they're just a fungal infection.
Right. Okay. Okay. Well, that's very interesting because, I mean, unless you've had one, it's really difficult to understand, or unless you work in the healthcare field specifically with feet directly, you don't really hear of these things or know about them as often as one would, right? So I want to thank you so much for all of these tips. Vickie, how do people in Kingston contact you for an assessment and then possibly a treatment afterwards?
So I have a Google business profile. So you can just Google like a Step Forward Kingston. You can find me on Google, and I have a booking right on my file, so you can book the appointment. So I also have, should I say my number? Like
Absolutely. Well, not your phone number, but maybe an email address or your website address.
sure. So my website is like a stepforwardkingston.ca, and my email is stepforwardkingston@gmail.com. So you can contact me that way. And on my email, my website, there's a lot of information you can read through, and there's a booking button, and if you need to book appointment.
Wonderful. Well, thank you so much, Vickie. It's been wonderful. We look forward to seeing you at the show
Sure.
and learn a lot more about nail care.
Thanks. All
Thank
right. Thank
you.
you so much. And then we'll see you end of May.
Yes.